Hello everyone, in this video we are going to discuss about Gaucher disease. So Gaucher disease is a lysosomal storage disorder. The enzyme deficient here is glucocerebrosidase. What is the function of this glucocerebrosidase is it breaks down the glucocerebroside, that is a glycolipid, into glucose and a ceramide. Glucose and ceramide is a lipid molecule. So this ceramide is reused normally in the other lipid pathways like cell signaling and membrane structure formation. So whenever there is a GBA gene mutation, this glucocerebrosidase enzyme is deficient. So this leads to inhibition of this breakdown of glucocerebroside, and these are accumulated in the lysosomes in the macrophages, and these are accumulated in the organs which are rich in macrophages like liver, spleen, bone marrow, lungs and CNS, and cause organ damage because of the inflammation. So on bone marrow biopsy we can see Gaucher cells where we can see lipid engorged macrophages, that is large cells with eccentric nuclei, and cytoplasm have a crumpled tissue paper appearance. So this picture is showing a Gaucher cell with eccentric nucleus and cytoplasm showing crumpled tissue paper appearance. So the inheritance of this disease is autosomal recessive. The gene affected is GBA gene on chromosome 1q21. And enzyme deficient is glucocerebrosidase, also called as beta glucosidase. The substrate accumulated is glucocerebroside. So we can see cells called as Gaucher cells, and these affect the organs like liver, spleen, CNS, bone marrow, lungs. There are three types of Gaucher disease: type 1, 2 and 3. Type 1 is having no CNS involvement. Type 2 and 3 are having CNS involvement. So type 1, it is a most common type and it occurs in childhood to adulthood. It have a good prognosis with treatment. The features are hepatosplenomegaly, anemia, thrombocytopenia, bone crisis and fractures. Type 2 and 3 are neuronopathic because they have CNS involvement. Type 2 starts in infancy and type 3 starts in childhood. So type 2 is more acute neuronopathic, so there will be rapid neurodegeneration with spasticity, seizures and hepatosplenomegaly. So since there is rapid neurodegeneration, it is fatal within 2 years. Type 3 is chronic neuronopathic. Here the CNS involvement is moderate, so there will be milder neurological symptoms with eye movement abnormalities we can see, and organomegaly. So it have a variable prognosis. So the diagnosis is by enzyme assay, which is a gold standard. There will be decrease in the glucocerebrosidase activity. Genetic testing, where we can see GBA gene mutation. Bone marrow biopsy, we can see Gaucher cells, and imaging on MRI we can see Erlen-Meyer flash deformity. On MRI we can see the same, and picture showing the same here. Enzyme replacement therapy, the treatment includes enzyme replacement therapy, which acts instead of this glucocerebrosidase and breaks down this glucocerebroside into glucose and ceramide. So these are imiglucerase, velaglucerase and taliglucerase. And substrate reduction therapy is miglustat and eliglustat we can give. Supportive care includes analgesics for the bone pain, and splenectomy can be done rarely. Potential future research is based on the gene therapy. So these are the important points. Things we have to remember is type 1 there is no CNS involvement. Type 2 and 3 have CNS involvement. Type 3 have eye related problems and mild neurological symptoms, whereas type 2 is acute neuronogenic, there is rapid neurodegeneration is there. The main cells are the Gaucher cells, which have eccentric nuclei with crumpled tissue paper cytoplasm. On MRI we can see Erlen-Meyer flash deformity. So these are the important points in the